Working as a caregiver in isolation. If you don't like the job, you cannot complain, because if you don't like the job, then you have to leave. We have no right to organize, to become part of associations. It's not, the law doesn't excludes us from all of this.
Well, thank you all for being here. I'm Beth Gatelius from the University of Illinois at Chicago. And for the last 2 years, I've been part of the research team that's been working on this report, Home Economics, the Invisible and Unregulated World of Domestic Work. So we're here today to talk about the release of this groundbreaking new report, which documents for the first time the working conditions behind the closed doors of our neighbors, families, and friends' homes. The work of nannies, house cleaners, and caregivers is notoriously difficult to document because of the hidden nature of the work. And it's this isolation that makes domestic workers more vulnerable to substandard working conditions. These substandard conditions are clear in the data that we'll be presenting today, drawn from 2,000 domestic workers in 14 cities across the country. Here in Chicago, there are more than 11,000 domestic workers employed in homes across the city each day, caring for our elders, cleaning our homes, and feeding our children. Low pay is a systemic problem in the domestic work industry. Our survey found that 23% of workers are paid below the state minimum wage. And this is the result of a tragic combination of poorly delineated tasks, long workdays, and low pay. One worker we interviewed, Anna, made just $1.27 an hour. Adding to this kind of financial insecurity, 23% of workers also report being paid late. Domestic workers face financial hardships because of this low pay they receive, and basic needs end up going unmet. Consider this striking statistic. 20% of workers report that there had been times in the previous month that there was no food in their home because they had no money to buy any. That is an extreme form of food insecurity. Additionally, 48% of workers earn a wage below the level necessary to support a family of 3. While experts counsel us to spend less than a third of our gross income on housing, 60% of domestic workers spend more than half of their income on rent or mortgage payments. Domestic work can be hazardous, and workers face the risk of long-term exposure to toxic chemicals and a range of workplace injuries. 38% of workers had suffered from work-related wrist, shoulder, elbow, or hip pain in the last year. Body soreness, skin irritation, trouble breathing, contracting contagious illnesses. There's a long list of common health-related problems stemming from this work. Yet despite these common work-related health issues, 65% of domestic workers have no health insurance at all, and only 4% have employer-provided health insurance. Domestic workers experience abuse and disrespect on the job, lack formal employment contracts, and fear employer retaliation for reporting problems. Of those workers who did have some sort of employment agreement, 30% report that their employer disregarded one or more provision of their agreement over the last year. 91% of workers who encountered problems on the job did not complain because they were afraid they would lose their job. And this problem is compounded for undocumented workers, 85% of whom reported that they didn't speak up because they were afraid their immigration status would be used against them. Not all employers of domestic workers are bad, but the substandard working conditions experienced by domestic workers are exacerbated by the lack of employment law that covers these occupations. The history of domestic work in the US is a history of exclusion and marginalization, a remnant of slavery that stretches into the present. Domestic workers hired directly by employers are not subject to all state-level minimum wage laws, workers' compensation and unemployment insurance, rights to overtime pay and meal and rest breaks, and other forms of other national labor law that other workers enjoy. These are the kinds of laws that need to be reformed in order to help improve and raise the floor on these working conditions. And as the population of Chicago and the US continues to age, the importance of these care workers will only grow, and the data presented in our survey speaks to the urgent need for reform. So we're joined today by domestic workers from different organizations in Chicago who are organizing to try to change working conditions in the industry. So first up, we'll have Barbara from Arise Chicago to talk about her story, to add meaning and urgency to the statistics, and to ground this here in Chicago. So Barbara?
Hi. Dzień dobry.
Good morning.
Nazywam się Barbara i pracowałam jako pomoc domowa przez 10 lat. Zajmowałam się opiekowaniem dzieci, osobami starszymi i sprzątaniem.
My name is Barbara. I worked for over 10 years in domestic worker occupation. I've worked in childcare, housekeeping and caregiving.
Jest to ciężka praca, szczególnie na zamieszkanie. Jest to praca 24 godziny. Jest bardzo wyczerpująca, ponieważ trzeba być sprawnym zarówno fizycznie, jak i umysłowo.
This is very risky job. For living worker is the job for 24 hours. Is physically demanding and is mentally demanding, is exhausting.
Jednej z mojej pracy, gdzie opiekowałam się osobą starszą, upadłam i poważnie uszkodziłam sobie nogę. Jako pomoc domowa jest niemożliwe dostać ubezpieczenia pracowniczego. Dlatego i zresztą podejrzewam, że większość i innych pracowników ma ten sam problem.
In one of my jobs, caring for the elderly patient, I fell and seriously injured my leg and lost the job. As a domestic worker, there is no way for me to receive workers' compensation. And like almost all domestic workers, my employer did not provide the health insurance.
Miałam problem z nogą. Cały proces trwał prawie 6 miesięcy. Przez pierwsze 6 tygodni chodziłam o kulach, później miałam brace, a później ponad 3 miesiące fizykoterapii.
To heal my leg, I had a procedure done. I rode a knee brace for 4 weeks, used the crutches for 6 weeks, and did physical therapy for 3 months.
Oczywiście nie miałam ubezpieczenia i całe koszty przede wszystkim życia musiałam wykorzystać swoje oszczędności i dziękować Bogu, że je w ogóle miałam. W przeciwnym układzie, nie wiem, prawdopodobnie wylądowałabym na ulicy z uszkodzoną nogą i bez mieszkania.
In order to leave my cost of living and part of therapy, I had to use almost all my savings. I'm lucky I had savings. Without savings, I would have become an injured, homeless person.
Jest ciężko. Miałam duże problemy z balansowaniem koszty w zasadzie po części leczenia, jak i płacenia swoich rachunków. Aczkolwiek myślę, że wiele osób znajduje się w podobnej sytuacji, ale o tym też nie mówi. Moja noga w zasadzie już jakby jest wyleczona, ale ona już nigdy nie będzie taka, jak była wcześniej.
While I recover, I could not work. So it has been extremely difficult to balance paying all the costs of living and partially my medical costs. Now my leg is almost healed, but never will be like before, and I'm looking for a job again. I'm also, I want you to say that there's more of domestic workers like me that cannot gain workers' compensation and need to improve the workplace. Thank you.
Thank you.
Thank you, Barbara. I think Digna from the Chicago Coalition of Household Workers will be next.
Mi nombre es Digna. Yo trabajé hace 28 años con una familia en una casa que tenían 2 niños de 3 y 5 años. Me tocaba trabajar
My name is Digna. I worked years ago for a household that had 2 children, 3 and 5 years old.
Tenía que hacer todo el quehacer de la casa, limpieza, lavar, planchar, pero sí había una persona que cuidaba a los niños.
I had to do all of the house cleaning work. I had to iron and clean and wash the laundry, and there was someone else who was responsible for taking care of the children.
Pero cuando faltaba la niñera, me ponían a mí también a hacer el trabajo de niñera.
When the nanny didn't show up to work, they made me take care of the children.
A mí me pagaban a $3.35 la hora.
They paid me $3.35 an hour.
Al tiempo le dije al señor de la casa que si me podía aumentar un poquito más de salario porque cada día me daban más trabajo, más responsabilidades.
One day I asked the owner of the house if he could raise my salary a little bit because every day they were giving me more responsibilities at the home.
El señor me dijo que sí, que me iba a dar 25 centavos más.
He said, "Sure, I'll give you 25 cents more an hour."
Yo me sentí muy contenta. Creí yo que me estaba dando mucho.
I was feeling happy about this. I thought they were giving me a lot.
Pero a los pocos días, el señor una vez llegó más temprano a la casa
In just a few days after that, this man, he arrived a little bit early home,
y me dijo que si yo aceptaba algunas proposiciones de él, me podía aumentar hasta $1 más.
he told me that he would raise my salary up to $1 more per hour if I would accept an offer he had for me.
Por supuesto que yo me negué, entonces él me quiso agarrar a la fuerza, o sea, violarme.
So the offer, he was making a sexual offer to her, and of course she neglected this and she denied that she wanted this.
Le
And
di-
then he grabbed her by force like he was going to try to rape her.
Le dije que se lo iba a decir a su esposa y él me dijo que la esposa no me iba a creer a mí.
I told him I was going to tell his wife about this, and he said that she wouldn't believe me anyways.
En efecto, yo me salí llorando de la casa y esperé a la señora afuera de la casa.
So I left the house in tears, and I was waiting for his wife to come home outside of the home.
Cuando yo le dije a la señora lo que había pasado, me dijo que era mejor que me fuera.
When I told his wife what had happened inside, she told me it would be best if I left.
Los niños, cuando oyeron eso, empezaron a llorar y se agarraron de mí y me dijeron que no me fuera.
When the children heard about this, they grabbed onto me and they begged me to stay.
Pero la mamá no les hizo caso y de todas maneras me despidieron.
But this didn't matter to the wife, and at the end of the day, I was fired.
Eso es muy triste porque además de ofenderme, de poner por el suelo mi dignidad de mujer, de trabajadora, también no les importó el cariño que los niños le tienen a una persona que los cuida bien.
This was very sad for me because not only was I offended, not only did they try to take my dignity away from me, but they didn't even care about the children who loved me so much.
Y eso sigue pasando, señores, aquí en Estados Unidos, con todas nosotras que somos las trabajadoras, que dejamos nuestro hogar, nuestros hijos, nuestras familias, por ir a cuidar una casa, por ir a cuidar unos hijos, por ir a hacerles el trabajo que ellos son bien pagados en sus trabajos, pero a nosotros no nos pagan bien. Muchas gracias.
Ladies and gentlemen, I'm sad to say this, but it still happens today with domestic workers. Many of us, we leave our homes to take care of the homes of other families, to take care of children and clean the house. ¿Qué fue la última cosa que dijiste?
Y que no les importa que una persona les haya cuidado bien los niños, les ha dado cariño, y no les importa y siempre despiden a la persona que más les ayuda, que deja su casa y su hogar por hacerle el trabajo de ellos en sus casas. Nosotros también somos seres humanos y necesitamos los beneficios como todo trabajador.
So sadly, these abuses happen where domestic workers leave their own homes and their own families to care for other homes, and they are abused and they are badly treated, even though they bring love to their work every day.
Gracias.
Thank you.
Next, we'll have Lisa, also from the Chicago Coalition of Household Workers.
Hi, I'm Lisa. I've been a caregiver for 21 years. One of the ladies that I take care of, she has dementia. She's in the latter stages of dementia. I'm there Saturday and Sunday from 8 to 12 midnight. Some days, most of the time, I have to get there at 5 a.m. because if I don't get there at 5 a.m., I'll find her down the street somewhere. The daughter and the husband upstairs in the bed. I find her down the street at the gas station with a Depends on, her bra, a skull cap, hat, a skull cap, gloves, and her boots, waiting on the bus. So when I mentioned it to the daughter that if they could just be there until I get there for her, she told me that that's my job, that's what they pay me for. But I don't start till 8 o'clock. You know, I work from 8 to 12 every Saturday and Sunday. Some days I'm there, most of the time, all night. I'm there 24/7, and they don't pay me for it. Last year, from October to January, I didn't get paid. She made excuses why she forgot to pay me. You know, I got sick a couple of times, and I sent my daughter to work because I couldn't afford to lose my job. And that time that I was off, my gas was off, and in the process of falling behind on my rent. And when she finally decided to pay me, I was called everything but a child of God. And that's her mother. And the bottom line is I could have left, but I love my seniors and I love the work that I do. And each day I come, she always say to me, "You're not going to leave me. You're not going to leave me, Sheila." My name is Lisa, but that's what she called me. "You're not going to leave me, Sheila. I'm waiting on you, Sheila." You know, I just want to say that I love what I do. And I deserve better than what I get. Thank you.
And last, we'll have Mirla, also from the Chicago Coalition of Household Workers.
I worked in the suburbs of Chicago for 5 years for the elderly, and I was earning like 1,760. That's 110 a day. And I work for like 96 hours a week. I'm not entitled to, like most of those who are in the study, I'm one of them who's not entitled to a minimum wage. So it's like I'm earning an average of $4.50 an hour. And then I don't get any overtime pay. And then, so I pay my taxes. And I have 4 adopted children, and I send $800 to them, so nothing much is left for my health care. So I go to Cook County, and then if I go on a sick leave, I'm supposed to get somebody else, and I pay her. The employer doesn't pay the person, so like me, many others don't want to go for a sick leave or even for consultation with a doctor. And I have some friends who died on their patient because she's not been checked in terms of her health and blood pressure. And it was a big shock to everyone. So some of us are flown back to the Philippines in caskets, or we are cremated because we don't know that we have illnesses because we can barely afford to have this, medical consultations. And then, yeah, there are also cases of verbal abuse, patients scratching you while you're working with them, and then there are no contracts. You work for many hours, the work gets longer, you are subject to the whims of the families. Like one family would like you to take the blood pressure every hour, which even the medical team says is not supposed to happen, but you have to do that because the daughters want you to do that. So the work gets longer and longer, and so there's no end to it. And then you work in isolation. You work for 24 hours. 24 hours, and then like 5 days, no day off. Because if you go on a day off, you have to get somebody else and pay that person the same payment that the employer gives you. So these are just the realities of working as a caregiver in isolation. If you don't like the job, you cannot complain, because if you don't like the job, then you have to leave. We have no right to organize, to become part of associations. It's not You know, the law doesn't excludes us from all of this. So, yeah. So I would like to invite you all. This is the reason why I became a full-time organizer for Latino Union and the Chicago Coalition of Household Workers. For every family that I went to, I was expecting that I will be treated with respect and dignity, but it doesn't happen until I realized my rights and the basic reasons, and this study also gave me the opportunity to see the larger picture. It was like you talk to everyone and it's all the same thing, but you see that if you say 60%, if you say 20% are not getting food, you know, they don't have enough food, it's, you know, it makes it more, the work more, it makes it more important that the work that makes all other work possible is not being treated with respect. There is not, you know, dignity in the work, and it's hardly gives you money to survive on. So I would like to invite you on behalf of the organizations here. There is a campaign called the Caring Across Generations, and we're going to have the Chicago Care Congress. In the policy recommendation of this study, I understand that there are recommendations for the employers, recommendations for the state laws and federal laws to be changed. And then, so we're bringing together all the stakeholders. We're bringing together the workers whose rights need to be protected. We're bringing together the consumers, the disabled, and the elderly in the community, so we can work on this care crisis that is gripping America. Soon, we will be faced with a lot of problems, like the shifting demographics of more and more people. More people are getting old in America, especially the baby boomers, so there will be a huge number of people to be taken care of who would need care. So with this problem of a substandard work in the work for caregivers, there's a very heavy turnover. And so we would like to invite you on Saturday. It's called the Chicago Care Congress, for everyone to discuss this problem and come into agreement for the platform or proposals to change the situation. So this is going to be on Saturday, December 1, 2012, 11 a.m. to 3 p.m. at 229 South Halsted, Chicago, Illinois. We hope to see you there. Thank you.
So I think the data that I presented earlier and these stories really speak to the need for some real reform, some urgent reform in this industry. You'll notice that all of the speakers were women. 95 to 97% of these workers are women doing women's work, and their paychecks and the working conditions, I think, are sadly speak evidence to that. So we'll take some questions now from anyone and to anyone up here.
I can ask in English, right? It's not the translator. Okay. I just want to know from an immigrant standpoint, how, in your experience and other experiences that you've seen, how often do people just keep quiet about just because of their immigrant status? Like how does that affect the workers? Like is it something used to control the people? Are they allowed to call in and is it a reasonable thing? And if there's any education for the people that don't know about their rights as immigrants, do they know about their own rights, and if they do have rights as a worker? I know that's so confusing.
Sí, cuando yo encuentro personas que son trabajadoras del hogar y les digo que nosotros tenemos una clínica legal para ayudarles, muchas veces no lo creen porque como ya han pasado por tantas situaciones de que han abusado de ellas, de que las han amenazado.
When I come across workers, I tell them that we have rights and that our organizations even have a legal clinic where they can access free legal services. Many undocumented workers don't even believe that there is support like this. They've suffered a lot of abuses already.
¿Cuántas veces
I don't think she finished.
Oh, sorry.
You can- Puedes seguir.
Ella no está hablando español. ¿Cuántas veces?
¿Usted ha visto a alguien que deportaron a alguien por un caso que pasó con una familia?
Oh, sí, he visto como 6 casos de esos.
She asked, how many times have you seen a situation where someone has been deported? And she said, I've seen 6 cases of a worker being deported.
And my last question is, para la familia que queda atrás de las personas, muchas veces quedan los niños atrás por eso.
Sí, muchas veces quedan los niños atrás, quedan llorando, quedan con familiares o quedan en una iglesia con las personas de la iglesia que se hacen voluntarias para cuidar a esos niños.
She asked, so when a mother is deported or a worker is deported, what their children are left behind, is that right? And Digna said, yes, that's correct. The children are left behind crying because they lost their mother. Sometimes they are taken care of by other family members, sometimes by neighbors or a church. It's very sad.
Gracias.
Gracias.
And I just want to add, part of the recommendations in the report are a path to legalization. And the Caring Across Generations campaign is one campaign where we are organizing to create a path to legalization for caregivers who can access new types of training in new schools and training workforce development programs that we're hoping to create through this campaign.
Quick question about the program. Does that include in English, like teaching them English and things like that as well?
I'm sure it will include something like that. We're still in the early portion of the campaign, but that's a service a lot of our organizations provide already to domestic workers and other workers.
What alternative employment actions do these workers have?
Okay. Well, for me, I do private duty, and I work through an organization that has a union. For me,
We're also working on working out building cooperatives so that we can gather together and find jobs and be treated in that process. Like in my organization, Latino Union, they were able to get, for those who are excluded under the law, they're getting $13 to $20 per day now because of the cooperatives that they have come up with.
For our worker, for Barbara, she is in the legal process right now to see what else is with her health. But rather than that, there are we will call middleman agencies, the agencies that define the job, and basically she will go and look for the other job. What we do in Arise Chicago, we educate, we do the workshops, basic Know Your Rights for domestic workers and for other people if they're interested again. Bilingual is either in Polish or in Spanish. And there is a great program, Know Your Rights as an Immigrant, prepared by ICR, Illinois Coalition for Immigrants and Refugee Rights, that we always recommend. And we always have the outreach to the other organizations that they offer ESL classes, because we believe that knowing English and trying to prepare yourself for future here in the United States is very important. Like we mentioned, Care Congress, that is going to happen Saturday, will open the eyes to many people what this new legislation will bring. Path to citizenship is one of the key points that immigrant community will gather around, but also to point out that our society is aging, and there are the steps that everybody will need to take care of. It's not only a problem for immigrants, but also for our society. Thank you.
Name and position, please.
My name is Anna Jakubek. I'm the Polish organizer for domestic workers in Arise Chicago.
Is going into a different field an option, or it's something that these workers are interested in, and maybe going into food service instead, because they are subject to
Those who can qualify it, yes, they can go and look for a help like a food stamps. But mainly they are not paying unemployment, and they cannot pay unemployment because the occupation that they do is invisible. So basically, if somebody is a domestic worker, it doesn't qualify as an occupation. Like we mentioned, cannot get workers' compensation. They can somehow pay unemployment if the employer will put them on as an employee and give the different form that calls to W. But most of them, they don't do that. They work as a subcontracting, and they're excluded from most of the laws. Right now, next week we have the veto session, and there's going to be a decision made about the minimum wage. We are trying to advocate for domestic workers to be added in the minimum wage, because even they're working, they're not guaranteed minimum wage here in Illinois. And we are going to add that for just safety, so they can go and complain if they have a courage.
I just want to add a few things. My name is Hart. I work for DePaul University, but I've been an ally to organizing domestic workers for now about 10 years, so I'm very happy to see there's finally a public voice. But I've also been in part of a coalition that's been trying to put together a domestic workers' bill of rights, and that addresses the issues, not only that domestic workers are specifically excluded from certain federal and state laws. They're also, even if they are included in laws, the laws are not enforced, or they're not enforceable, which has to do with the fact that they work in isolation, they're afraid of complaining because of their immigration status, or they're also in the power differential in the families. So there also need to be policies that make existing laws more enforceable. And the third part we want to address in our Bill of Rights is also the fact that it's industry-specific challenges for domestic workers. For instance, live-in domestic workers, and this is also in the report, is very well described. Very often they have no uninterrupted sleep time. So one of the issues we want to also, there has to be a right for at least a minimum of 5 hours uninterrupted sleep. That's one of them. Or then also, because of the culture differences, that they are allowed to use kitchen facilities to cook their own food, because that's also an issue, or the food that's provided is not healthy. So we are in the process of pulling it together, and we want to address those 3 dimensions.
Does anyone know the percentage of domestic workers who need government assistance, just who are on food stamps
That's not a question we asked in the survey, but given that 47% of our survey respondents were undocumented, I think it's probably, if they are able to access them, they would, because of the widespread substandard pay. But since it's not a question we asked, I can't give you a percentage of how many use food stamps or other government assistance.
What's the psychological toll for, as a worker, to have to take care of somebody else's children and leave yours at home? That can be whoever wants to answer that.
I never took care of children.
¿Me puedes repetir la pregunta, por favor?
¿Cómo se siente usted psicológicamente, emocionalmente, tener que dejar sus hijos y su familia para cuidar a otra gente, los de otra gente?
Bueno, cuando nosotros dejamos nuestros hijos para cuidar a otros, los hacemos con el mismo amor como cuidamos los de nosotros.
When we leave our children behind to take care of other children, we give those children the same love that we give our own family.
Pero sí quiero decirles una cosa. Cuidar niños, cuidar ancianos, limpiar casas. Si a nosotros nos tratan bien, nos pagan lo justo, por lo menos, yo creo que lo hacemos con mucho más amor, más cariño, porque nos están pagando muy bien y nosotros hacemos todo eso con más voluntad.
I want to say something that I believe. Those of us who clean homes, who care for children, who care for the elderly, we do it with so much love. But if we were paid a fair wage and had fair working conditions, we would bring even more love and energy to our work.
Yo creo que a todos deberían de gustarnos el trabajo que hacemos. Es bonito cuando nos gusta el trabajo que hacemos a todo el mundo. Es feo cuando uno está haciendo un trabajo solamente por el dinero que le pagan.
I think the love that we bring to our work should be recognized. It's a beautiful thing when we bring love and respect to our work, and it's very ugly when our work is not recognized.
Otra cosa que quiero decir, yo creo que el trabajo de una trabajadora del hogar, una nanny o una cuidadora de personas de la tercera edad es un trabajo muy digno y muy respetable.
There's another thing I want to say. The work of a domestic worker is dignified work, and it's very respectable.
Y otra cosa es que le quiero decir a todas las trabajadoras, a todas las personas, a todas esas personas pudientes, como son los senadores, los doctores, los licenciados, todas esas personas, estoy 100% segura que necesitan de una trabajadora del hogar, de una nanny, de una persona que les cuide tal vez su persona anciana en su casa.
There's something that I want to recognize. Just so many people in our society, doctors, lawyers, people with professional licenses, they need a domestic worker in their home, a nanny to care for their children, or a caregiver to care for their elderly family member.
Y como todas esas personas tienen beneficios, nosotras las trabajadoras también necesitamos beneficios porque somos seres humanos y el trabajo que les hacemos, se los hacemos con mucha dignidad.
And if all of these professionals have the right to benefits, us domestic workers too should have the right to benefits because we bring a lot of dignity to our work.
Gracias.
Thank you.
I would like to take a shot at the question. I'm organizing somebody now, and her child, who is 17 years old, didn't want to go to school anymore. She's been here for like 12 years. She doesn't have papers. And so she's back and forth with him every day, every night, trying to get him to be functional. So that's just one effect of being, leaving family behind.
What do these workers do as far as retirement? I notice some are a little bit older, so once they're not working anymore, where's their income coming from to live off of it?
Go ahead.
It's a very hard question to answer because we don't have savings. So it's like I have one example of a person whose patient died. She's already 65 years old, but she still couldn't go home because she doesn't have enough savings to go home. So she told me that she's going to extend until she gets another permanent job so she can have a saving to go back home to the Philippines. So there's hardly none because these are poverty wages that we are talking about. I mean, I keep telling them and I organize them, it goes way longer than, if you send it over to the Philippines. The dollar exchange is $1 to 45 pesos. So you're able to give it there. But, if you live here, really live here, with all the needs that you have for health care, insurance, retirement, you don't really have any of those.
nie ma możliwości, płace są tak niskie, że nie ma możliwości na retirement.
The wages are so low that it's basically impossible to retire with a dignity.
W przypadku nawet mojego, wszystkie oszczędności, jakie nawet mamy, nie mając ubezpieczenia, to po prostu i tak musiałam użyć na codzienne życie. Także bilans jest na zero.
In Barbara's case, she was saving money for the retirement when the retirement comes, and then her accident and all the savings during the one accident is wiped out. She's on the zero again, and she has no possibility to retire with a dignity right now.
Thank you.
One thing that was so striking when we were fielding the survey was that there were women who were, in their 60s doing elder care. So women who will very soon need their own elder care, providing care to other people. Again, because there are so few benefits that go along with this work, it's not as if they're getting a pension. Less than 2% of the workers we surveyed receive any kind of retirement or pension benefits. So it's very, very few lucky workers who get anything at all. And so I think in their retirement, they're struggling is the short answer. Anyone else?
Thank you so much.
Thank you.
For coming. Thank you.